I see our colleague from Illinois was getting kind of excited and wanted to get into this and add to this, so please do.
I wanted to point out that our colleague, Representative Carolyn Maloney from the Economic Commission, which just did a study, too, on the effects of health care, the current health care problems that women face. And one of the things that she mentioned, which I hadn't really thought about, is that a number of men reach the age of 65 and retire and go on to Medicare, while their wives, who are often younger than they are then left stranded, because many of them have been on their husband's policies, so the husbands go into retirement, they have the coverage, and women don't. So we have this period between 50 and 65 where men and women alike are left stranded. One of the things our bill does is to create a $5 billion pool that would be available for people in those 50 to 65 years to get some help with their health care. So in addition to making sure that women can go onto the exchange. The other point I wanted to make about women is many women, men too, but women often work in small businesses. Big beneficiary of this legislation, and it starts right away, are small businesses who are going to get up to a 35% tax credit on their premiums, and that will be immediately available to firms that choose to offer coverage to their employees. And a lot of those employees are women. A lot of those business owners are women. And so this is another way that our bill will help women and men alike.
Let's take this just for a little more, and then I really want to come back to something that you talked about, and that is the bill that you introduced having to do with the rate regulation process. But before we go there, a statistic just came out from the Labor Department that the majority of workers in America are now women. If we keep women healthy, then the productivity of America is substantially increased. And in order to stay healthy, women or men, you really need that health insurance that provides for the preventative care. And that is in this legislation, that there is an expansion of the preventative care services. For seniors, they'll be free. For the rest of the public, insurance policies will have to offer that preventative care. So if we keep women healthy, the productivity of the nation is going to increase. So for many, many reasons, we'll come back and deal with the issue of the overall economy in a few moments. But I really would like you to pick up the issue that you raised about rate regulation as a result of the extraordinary announcements that the insurance companies made about their rate increases. Tell us about what you've introduced.
Well, first of all, it's no wonder that the insurance industry is fighting us tooth and nail, and with millions upon millions of dollars in TV advertising, because they are making so much money, and they do that by raising their rates. And it's really astonishing to me that in this period when the Congress is discussing how we're going to change and make the health care system affordable for people, that they have the utter audacity to show their true colors by raising their rates. Let's look again at your chart. In Anthem Blue Cross customers, that's in California, right?
That's California.
94% rate increases in the last 2 years. Something clearly needs to be done to get them under control. This bill does that. It says that they will have to justify, they'll have to open their books, they'll have to explain, and if they can't, the rates can be modified, consumers can get a rebate. Enough of their taking such tremendous advantage of American consumers.
I think in the